In the average year, we do 2 to 3 deals. We are, always looking for IT services and device and diagnostic deals that have the ability to improve quality and reduce cost. Those are the two things we look for very seriously. They have to align the incentives, both financial and clinical, of the patient, payer, and provider for us to pay attention. But that's what we're looking for.
Mm-hmm. What's the one question you ask during the process with a startup or a company you're going to invest in that often they fumble or don't know, or it's critical that they answer?
What is the actual economic ROI of what you do? I mean, they usually come in and say, it saves money and it does all these fabulous things, and we say, give me a concrete example with numbers of how much it costs to buy your system, implement it, and then what is the return to the buyer in dollar terms, and how long does it take to get that? And they have a very difficult time often answering that question. And I think it's the only question that matters in the beginning, because today, if you can't show that your system saves money, no matter what else good it does, it doesn't matter. It's a difficult conference, actually, for, I think, me as an investor, because there's so much noise and a lot of things that look very similar. And I think what we're really looking for is products and technologies that will make a significant difference in how people transition from the world we have today to the world where the consumer truly is a player in the delivery of healthcare and the purchasing of healthcare. So things that help these companies rebrand themselves and re-establish their functionality in a marketplace where the consumer is the primary buyer after health insurance exchanges come to light in a significant way, as well as the types of products and services that are going to meaningfully move the needle on the clinical experience, where the cost, of course, is buried. So companies that actually improve care coordination, post-discharge from the hospital, prevent the onset of significant chronic illness and help people manage it so they don't have significant breakdowns in their health. You really have to find technologies that engage both the consumer and the provider and the payer all together in a system in order to make a difference in the cost. There's so much buzz and activity around EHR, EMR, and analytics. Those words are almost becoming meaningless, and people saying them so much. I think what we'd like to see is some analytic type tools, but also the front end of how they get used by the people who are able to make a difference in the way care is delivered every day. So practical tools that whether the nurses, the doctors, or the patients, or the payers can apply in their everyday functioning to change the way they do business. And I think it's hard, because these are things that require probably significant changes in workflow, changes in corporate culture and how things are done. But there's a lot out there to collect data and to pull it all together, but there's not a lot to take it and use it from a pragmatic standpoint to make a difference day to day in how operations occur.